My name is Naomi Dempsey, and I'm a breast medical oncologist at the Miami Cancer Institute in South Florida. We've been very fortunate in the past few years in breast cancer to have a number of new approvals for targeted agents for advanced breast cancer. We now have a new approval for the oral SERD, Elacestrant, for patients with advanced breast cancer and an ESR1 mutation. And we also have an approval for alpelisib plus endocrine therapy for patients with a PIK3CA mutation. So finally, we feel like we're spoiled with riches and have options. So now it becomes important to decide after someone progresses on CDK4/6 inhibitor, what are we going to choose? And certainly there are some patients who will have both of these mutations. So I think the first thing that's important to note is that when a patient has progressed on CDK4/6 and it's time to choose a new second line option, this is a great time point to be doing your liquid biopsy or tissue-based next generation sequencing testing to determine if they're a candidate for any of these medications. If patients have had a good amount of time on CDK4/6 inhibitor prior to progression, something like 12 months or more, and they have an ESR1 mutation, elacestrant would really be my go-to. If they had an ESR1 mutation but a very short amount of time, say less than 6 months on CDK4/6 and also had a PIK3CA mutation, I'd be more interested in using alpelisib plus fulvestrant. And certainly there are other options as well for those who don't have any of these mutations. Everolimus plus endocrine therapy is an option. And of interest, the Capitello trial that we saw at San Antonio gave us good data for the AKT inhibitor capivasertib. And we'll be looking out anxiously for that FDA approval. Of course, it's important for us to keep in mind for these patients as well that they should all undergo genetic testing, because if we find a germline BRCA mutation, then they could use either the PARP inhibitor olaparib or talazoparib. So there are many different options. We're keeping chemotherapy further and further down the line, which is a great thing for our patients. And there is more to come in this space.